study. I think we still have time. So you should be able to see my screen now, and I will going to share the remaining part of hypersensitivity. If you can recall, we were trying to study the different ways of hypersensitivity. हमने उसमें जो पढ़े हैं अभी तक type 1 and type 2. Am I right? हमने दोनों पढ़ लिया ना, mechanism of type 1. Type 2 नहीं पढ़ा हमने, mechanism of type 1 पढ़ लिया, ठीक है, हमने ये पढ़ लिया. And we will going to see about the type 2 hypersensitivity method. ये वो question था जो हमारे discussion और में शुरू से आ रहा था, बार बार लोग पूछ रहे थे कि ये क्या होता है, यानी कि autoimmune disease क्या होती है, hypersensitivity क्या होती है, allergy क्या होती है. So this is the high time that we will going to study about these things. Okay, so that's it. थोड़ा सा बड़ा कर लो अपने आप में, मैं जरा all set. So we will going to talk about the type 2. मेरे पास वो writing marker नहीं है, so it will be little bit difficult, but I will try कि मैं कर्सर की मदद से आपको explain कर पाऊँ. Okay, so let's start with the type 2. Any question from the type 1 hypersensitivity? I think that was understood कि क्यों एकदम से reaction होता है, sudden reaction क्यों होता है? Because आपके cells होते हैं, they are already ready to react at that time for the second exposure. So let's start with the next thing, and that is the type 2 hypersensitivity method. It is called as antibody mediated hypersensitivity. You can ask me, sir, वो पहले वाली भी तो antibody उसमें भी तो आती थी ना, लेकिन इसमें basically जो critical role play करता है hypersensitivity के पीछे वो antibodies करती हैं. मुझे इसको repeat करने की जरूरत नहीं है hypersensitivity क्या होता है. There are things out there which are not very much toxic, which are not very much bad. ये मुझे हमेशा करना पड़ता है, sorry. So there were things out there which were not supposed to be bad, which are not supposed to be toxic, but our body and our immune system started considering those things as something very bad and started reacting against them, and that is called as hypersensitivity. यानी कि जरूरत से ज़्यादा reactive हो जाना, beyond required limit sensitive हो जाना, and that is also a sort of disease. The immune system is supposed to fight against or supposed to react against the bad things only, but if it started reacting against everything or started reacting against the non-toxic stuff, then the resources of our body will be consumed in a useless manner, and that will actually put our body into a great risk of developing any sort of disease or getting infected more easily with other bacteria and viruses. So we have to be very. तो कितना मुश्किल काम है immune system का यार, एक तो उसने पकड़ना है और ऊपर से उसने सही चीज को पकड़ना है. Correct इसको. Since the parameters are quite complicated, that is why इसमें error के इम्कानात जो हैं वो बहुत ज़्यादा होते हैं. And one of the error is that the immune system started reacting against a less or non-toxic stuff. So okay, now let's see how an antibody mediated hypersensitivity occurs. Just focus on the picture and I will try to explain you. Where is that? Okay, for every antibody, as I explained earlier, there are two ends. The one of the portion is that in which the antibody used to bind with a cell, with an immune cell. That part of the antibody recognize something, recognize the cell of usually an immune cell. That place is here. This one, I am highlighting this thing is the place which actually designed to capture a particular specific immune cell. Now think about the other side. This is called as the FC receptor, this portion. Okay, this portion is highly variable. This portion is highly variable. That means it can change its shape. It is different in different cases. Thousands and thousands of types of antibodies are out there. They are all different in that part, which is also called as variable region of antibody. Okay, this thing is also called as the variable part of the antibody. The small that portion of that antibody is variable because it is designed to capture different things. It is designed to capture different types of antigens. Since we are experiencing lots of antigens, so we can expect thousands of different types of antibodies should be there in our body. Okay, so that is how it works. So, the antibody usually attached with an immune cell like this one from one side, and from the other side usually it is attached with an antigen, something which is like a bad thing. An antibody is designed to capture or fight against that thing. But sometimes it happens when an antigen antibody reaction occurs. When an antigen antibody reaction occurs, जब एंटीजन एंटीबॉडी का रिएक्शन होता है, आपको पता है एंटीबॉडी एंटीजन एक दूसरे को डॉक कर सकते हैं, परफेक्टली कैप्चर कर सकते हैं. Okay, I'm just trying to be very simple. Okay, forgive me for that thing. And then after that, it actually try to help. It actually results in the breakdown of that molecule. It's antigen antibody जब reaction होता है, तो antigen usually it actually broken down into smaller fragments or pieces. इसको बोलते हैं antigen antibody reaction in a simpler words. That releases small fragments and byproducts. Some of them are called as the complement byproducts. यानी कि जब antigen antibody attach हुआ था, तो उस reaction के नतीजे में कुछ byproducts मिले, कुछ fragments बनेंगे, कुछ नए छोटे smaller fragments बनेंगे. Okay. Now those little fragments, which are called as complement byproducts, they might be new to our immune system, because our immune system is familiar with this thing. Our immune system is familiar with this antigen in this form. During the antigen antibody reaction, that stuff is broken down. It gives smaller fragments. The smaller fragments might be new to our immune system, and that can touch and trigger the immune cells. Particularly, it can activate the neutrophil. It can activate the neutrophils. So then neutrophils start doing their job. But is the job of neutrophil? You need to go back to that lecture. Neutrophil ko padha tha. Okay, it actually start working in inflammation, contributing in inflammation, and also involves in tissue injury. When the neutrophil start doing job, which is it not supposed to do, the neutrophil is not required to be activated because the job is done. Antigen is destroyed. But because of the byproducts, क्या नाम दिखा उसने? आप आसानी के लिए C5a, C3a byproducts of that reaction, they actually trigger some of the members of the immune system. So if the neutrophil is not supposed to react, but it started reacting, producing the chemicals for inflammation and tissue injury, what will happen at that time? You will see at that place, जिसको बोलते हैं inflammation हो जाएगी, सूजन हो जाएगी उस जगह पे, and also you will feel, the immune reaction going on at that part of the body, and it is not required because you have successfully destroyed the antigen. But that antibody is responsible for the immune reaction or hypersensitivity. I mean, once you have deal with this thing, once you have comfortably deal with this thing, the job is done. The immune system should not be that much sensitive that it should even trigger against these things. Okay, you have done the job, even the smaller fragments. So the immune system should spare the smaller fragments at that time, but they are so sensitive or hypersensitive at that time, it is called that it actually started triggering some of the immune cells. G, I have a question. It's quite like much smaller than that. It's much, you go macrophages and pakad lein, so that will start a new immune reaction. Okay, and that is like we are at the end of the immune reaction. यहाँ पे कि एक जगह पे antigen antibody reaction हो रहा है, that is very last, it's very end of the immune reaction जहाँ पे. तो वहाँ पर antigen antibody reaction के बाद the story should finish. Theoretically, the job should be done. But what happens that out of that byproducts, the immune cells reaction or immune cells started feeling, activation. Neutrophil की example है. And that is not supposed to be there. Hypersensitivity के बारे में आप याद रखें, a reaction which is not supposed to happen. एक ऐसा reaction जो नहीं होना चाहिए ना, it should not be there, and that is a reason of trouble in many people. Okay, so just with the help of another slide, just look at that. So there is a reaction going on here, and antigen antibody reactions, and you can see this antibody is like is responsible in capturing. So not capturing, this antibody is supposed to attach with one of the member of the immune system, for example neutrophil, and on the other side it is holding the antigen. But because of this byproducts, if these neutrophils got activated, these are the byproducts, these byproducts can activate the neutrophils, and these neutrophils start releasing their things and will start affecting that region. So the effect of that region is not supposed to be there, because the byproducts of immune reaction should be safe. Antibody antigen reaction के जो byproducts हैं, they are supposed to be non-toxic, they are supposed to be safe things. But even if the immune system and or the neutrophil, they started feeling bad about the byproducts of the antigen antibody reaction, that means this is not nice, this is not normal, and they will start affecting that place. Type II hypersensitivity. Actually, this is another slide which describe the mechanism of use of a certain drug to target a molecule. This is called drug-induced reaction, drug-induced reaction to red blood cells. And you will see a similar sort of stuff over there. There is a red blood cell, and traditionally the red blood cells don't have a nucleus, but they have a cell membrane. They have a membrane proteins as well, and those membrane proteins are specific, and those can be considered as antigens. This triangular stuff is the antigen. These are the natural proteins present on the red blood cells. Okay, मैं आपको क्या बताने की कोशिश कर रहा हूँ? मैं आपको बताने की कोशिश कर रहा हूँ कि how people have targeted a specific cell with the help of the type II hypersensitivity method. Okay, from outside. So this is the natural antigen present on the cells. This is the natural antigen present on the cell. The circular stuff, okay, is a drug created by a pharmaceutical company, and that drug is able to bind with the red blood cells with the help of the proteins present on the red blood cells. So if you gave that drug to that person, that circular molecule or the drug molecule will be able to absorb, will be able to place itself, will be able to land on the red blood cells. So red blood cells को कौन पहचानता है? ये circular molecule, ये pharmaceutical company. Now the pharmaceutical company, यहाँ पर trick है. The pharmaceutical company has created an antibody against that drug. अब pharmaceutical company के पास ये वाली antibody है, and this antibody is able to capture, is able to touch what? Is able to capture the drug. उन्होंने पहले एक drug बनाई which can capture, which can find the red blood cells. They have raised an antibody against the drug. In the first shot, the drug was delivered. It will touch and capture the red blood cells. कौन से वाले red blood cells? The red blood cells of your choice. I don't know what was that. You can see. And then they sent the antibody. Once the antibody landed into the patient's body, what will happen? It starts finding the drug molecule. And drug molecules are where? They are present on the red blood cells. So all the antibodies ended up or landed where? On the red blood cells. Once the antibody captures or catches the antigen, that leads to the antigen antibody reaction. That leads to the antigen antibody reaction. And you know that this is called as complementation. मुझे पहले भी हुआ. This is called antigen or antibody का dock करना. This is called complementation. And it results in some fragments, and some of the fragments, you know, C5a, C3a, those are the fragments which actually came out as a result of that thing. And the complementation usually results in the problem or destruction or lysis. The first thing is that the pharmaceutical company is trying to create a molecule which can selectively catch a protein present only on the red blood cells. हमारे रेड ब्लड सेल्स के ऊपर बहुत सारी प्रोटीन्स होंगी, उनमें से कोई एक प्रोटीन ऐसी होगी which is only present on the red blood cells. Specific protein present on the red blood cells, not present on any other cell. If you administer that drug molecule will enter or landed or reach only to the red blood cells. यह है selective targeting करना. If in certain situation you need to reduce the number of blood cells at that place, if you want to decrease the number of blood cells, मतलब खुदा ना खास्ता किसी जगह पे इंजरी की वजह से इंटरनल ऑर्गन में खून चला गया या कुछ ऐसा हो गया है कोई इस तरह, I don't know, I'm not a medical doctor, but in a certain situation where you have to lyse the blood cells specifically without killing the WBCs, without killing the other tissues, without killing the other organs, so you can use this way. The drug will going to label the red blood cells, and then the antibody against that drug will go and start the complementation reaction. You need to, अब हम जिस टॉपिक में पढ़ रहे हैं ना, हमने कहाँ गौर करना है, हमने complementation पे गौर करना है कि antigen antibody capture होएगा, that will leads to the complementation, destruction and small fragments, and those small fragments usually results in the destruction of the cell or इसी तरह antigen antibody reaction काम करता है. वायरस infected cell के ऊपर जब antibody जाके लग जाता है, that will also results in the complementation. I don't know, मतलब मैं इसलिए मैं बड़ा चालाक हूँ, मैं तुक्का इसलिए नहीं मारा क्योंकि लेक्चर रिकॉर्ड होना है, बाद में लोगों ने कहना सर ने बोंगी मार दिया, हमें पता था नहीं इसको. बेटर टू एक्सेप्ट के आई हैव नो डायरेक्ट एग्जांपल मैं आपको नहीं दे सकता, बट the thing which I can tell you as a researcher that this methodology can be used to selectively lyse a particular cell. You can think about lysing any other type of cell with this type of drug, but you know इसमें हमें क्या चाहिए, इसमें हमें चाहिए स्पेसिफिक प्रोटीन. रेड ब्लड सेल पे कोई एक ऐसी प्रोटीन होगी जो किसी और में नहीं होगी. अगर फर्ज करते हैं, लेट्स सपोज इफ यू आर सुपर डुपर रिसर्चर and you able to find a specific protein present on the cancer cell, only present on the, ये बहुत रेयर है, कैंसर सेल आते कहाँ से हैं, they just came from the normal cells, so it is so difficult to find something which is only present in cancer cell. Very weird है ना. So if you able to find that thing, then it is possible that you can kill. मतलब ब्लड कैंसर में हो सकता है, ब्लड कैंसर में हो सकता है कि there are proteins which are very abnormal present on the blood cells and you want to get rid of the bad red blood cells. जो बुरे रेड ब्लड सेल्स हैं उनसे हमें जान छुड़ानी है जिनमें ये बैड प्रोटीन है. That is highly likely, highly possible. Let's study together ये क्यों करते हैं, ठीक है. And after that we will move to but नहीं एक और एग्जांपल पढ़ेंगे फिर हम मूव करेंगे type II hypersensitivity. It's a very famous example and I wish कि आप लोग इसको comfortably आराम से समझ पाएंगे. This is the mechanism in which we one way or another we know that there are stories about miscarriages in the moms which has a different blood group as compared to their kids. If they have a different blood group with respect to their kids. यहाँ पर भी बहुत बड़ी confusion है, लोग इसमें बहुत बोंगियां मारते हैं. मैं आज आपकी उस बोंगी को ठीक करने की कोशिश करूंगा. The thing is that just as a start, believe or remember the positive and negative blood groups. You understand that things. Rh positive, Rh negative. This is also called as RhD or only sometimes D as well in short. So the RhD means the Rh factor or the Rh positive. Okay. The presence of antigen, Rh antigen means the blood group is Rh positive. The absence of that antigen means the blood group is Rh negative. It also called RhD negative. Okay, so we will going to see कि blood group के difference की वजह से moms जो होती हैं, अगर उनका blood group negative है, उनके baby का blood group positive है, so under that conditions we heard that they usually unfortunately experience lots of miscarriages. So how it happens, that is we will going to explain in the next few minutes. So the blood of the mom is Rh negative. For example, O negative है, mom का blood group जो है वो O negative is supposed to be negative. Think about the fetus. The fetus blood group is positive. Nature has created such a wonderful separation between the mom and the baby. For the mom's immune system, baby do not exist. होना चाहिए ना ऐसे. I mean, it's like a state within the state. I don't know, but it's like that. I mean, अगर हमारे immune system को mom के immune system को पता लग जाए ना कि somebody is taking all the resources, वो तो उसकी बैंड बजा रहे उसी टाइम पे. Nature has put a very separate, a wonderful separation that it's like kept hidden from the mom's immune system. यानी कि moms का जो भी immune cells होते हैं, they able to present. moms के immune cells हर जगह है, brain में, tissues में, skin में, blood में, kidney में, हर जगह है, लेकिन they are not present in the place जहाँ पर a baby is developing. That's a special thing. So and a negative mother means that the mother is not having any antigen for the Rh factor. She is Rh negative, but she can fight or she can react against any Rh positive blood because she is carrying the antibody against the Rhd or Rh positive blood. ये बात समझ आ रही है? Mom Rh negative है, does not have any antigen, but that also means it has the antibody against the Rh factor. Means if the Rh positive blood came across the mom's blood will start reacting again because mom के blood में उसके against antibodies हैं. किसके against? Rh positive blood के. So इन दोनों का मिलना खौफनाक तबाही है if they ever came across each other. Now the mom is developing a fetus. I mean ये fetus एक cell से आया होगा ना, वो layers तो बाद में आई होंगी. ये बड़ा अहम सवाल है, बाद में बताऊंगा. But just think about that a mom has a Rh negative blood and the fetus is carrying Rh positive blood. What will happen at the postpartum? यहाँ पर ये बात लोग नहीं समझते हैं. Think about this is the first baby. And at the time of delivery, सब कुछ comfortably किया, nature ने protect करके रखा और fetus को amniotic fluid में with so many layers उसको protect करके रखा और mom का immune system नहीं देख पाया for the very end और baby जो है वो deliver होता. But at the time of delivery, it's I don't know, you guys should know, but you should know. I mean, you are adult enough to know all these things. I mean, almost the size of the baby, a material equivalent to almost the size of the baby is released during the normal delivery process. It's like placenta is a huge tissue. It's not like a nali. Nali is not a placenta. Placenta is a very big tissue present besides the baby. It's nourishing, it's protecting the baby, doing all the things wonderful. The umbilical cord, which usually people see in the newborns, that's a different thing. But imagine at that time when the layers were broken, when the amniotic fluid were released, when placenta detached itself from the mom's ovary. I mean, it's a little painful to imagine that a tissue which actually stick with the mom's body and receiving all the good food and releasing all the bad things. So यहाँ पर the mom's body will have to like जैसे कुछ चीज ऐसे उखाड़ते हैं ना दीवार से, they have to do things like this. So the placenta along with all the tissue at that time when the mom's blood came across the baby's blood, the umbilical cord and baby's tissues are like connecting in the placenta. At that time the mom's body for the very first time came to know, oh, and this is something weird over there, something which is not matched with me. So the mom's blood which is carrying the antibodies, क्या करेंगी? मॉम ने जैसे एक्सपीरियंस करना है RH पॉजिटिव ब्लड को, the mom's blood will start preparing the antibodies. आप जानते हैं क्या होगा? पहले मैक्रोफेजेस ने पकड़ा होगा, कैप्चर किया होगा RH पॉजिटिव ब्लड को, पकड़ो खाओ, ये कहां से आ गया, उसने प्रेजेंट किया होगा टी सेल्स को, टी सेल्स ने आगे प्रोलिफरेशन की होगी. ये बातें आसान लगती है ना, प्लीज है. एंड देन टी सेल्स ने उसके बाद हेल्पर टी सेल्स ने बीटा सेल्स को एक्टिवेट किया होगा, जागो समथिंग बैड इज देयर एंड दे स्टार्ट प्रोड्यूसिंग द एंटीबॉडीज. नाउ दोस एंटीबॉडीज विल स्टे in the body of the mom. First baby is fine, first baby is delivered, baby is safe, but the mom does not know, the moms don't have any, she don't have any understanding that her body is now carrying an antibodies against the RH positive blood. पहले नहीं था, exposed to postpartum stage के ऊपर हुआ है, जब deliver हुआ है, जब fractures rupture हुआ है, सारा कुछ उस वक्त हुआ. Now अब अगर the same mom, I mean, look at that. In the second pregnancy, in case of the second pregnancy, the mom is negative. Once again, but the mom is also carrying the anti-D. Okay guys, let me restart my lecture from where it was stopped. I wish कि आप लोग मेरे साथ होंगे जो मैंने इससे पहले आपको बताया और स्टोरी में, और पोस्टमार्टम कॉन्सेप्ट को नहीं भूलना है आपने, दैट इज वेरी क्रिटिकल। यानी कि उससे पहले मोम की बॉडी नेवर एक्सपोज टू RH एंटीजन और RHD। सो मोम की बॉडी के पास कुछ भी नहीं है, ना एंटीजन है और ना ही एंटीबॉडी। रिमेंबर एंटीबॉडी कब पैदा होती है? व्हेन समबडी इज एक्सपोज्ड टू द एंटीजन। सो एट द टाइम, अगर आप मुझसे पूछेंगे कि किसी RH नेगेटिव मोम को कोई ब्लड ग्रुप लगाता है RH पॉजिटिव, तो आंसर इज नो, कोई नहीं लगाता, वो पागल है, कोई लगाएगा? ये तो सीधी सीधी मौत को दावत देने वाली बात है। नाउ थिंक अबाउट दैट मॉम हु इज अबाउट टू डिलीवर अ बेबी हु इज नेगेटिव, oh sorry, who is positive. So a negative mom is about to deliver a baby who has a RH positive blood. So she is about to face a very real, very much strong and real threat to her life, because she will going to experience, अगर वो blood रह जाए अंदर, अगर blood stay कर जाए, ज़्यादा expose हो जाए उसकी body, the mom's immune system will have to work very hard to destroy all the RH positive blood cells out there. लेकिन even if the mom's immune system win, or usually it wins, the result is what? The result is the presence of anti-D. Now in the second pregnancy, the mom's blood is carrying the anti-D. Now once the baby is starting developing a positive baby, for the very first time, when the baby develop because of the genetical reasons, genes में है ना, positive होगा कि negative होगा, genes में होगा, तो जब पहली मरतबा ball of cells ने RH positive factor create किया होगा, जब पहली मरतबा उसने ब्लड क्रिएट किया होगा, that was the time when the mom's antibodies are able to capture and touch with those अब आप मुझसे पूछ सकते हैं कि सर वो मॉम और फीटस के दरमियान में वो दीवार कहाँ गई? एंटीबॉडीज आर लाइक द प्रोटेक्टर्स, दे आर सपोज्ड टू बी एवरीवेयर। इम्यून सेल्स नहीं जाते हैं, एंटीबॉडीज कैन। तो वो स्मॉल अर्लियर स्टेज के ऊपर फॉर द वेरी फर्स्ट टाइम when the baby's body started developing RH positive blood factors, the mom's antibodies, the antibodies against the D, जिसको कहते हैं anti-D, they will start reacting with the baby's blood. Baby का blood बनने ही नहीं देंगे, created, destroyed, and that will lead to the miscarriage. If the family and the couple attempted one more time, it will end it in the same way. They attempted again, it will end it in the same. As long as the baby is not negative. जी हसन आपने हाथ रेस किया। जी हसन पूछिए क्वेश्चन, शाबाश।
सर मेरा ये क्वेश्चन है कि जब
हसन जोर से,
मेरी
लैपटॉप की आवाज कम है, जोर से बोलिएगा काइंडली।
सर मेरा ये क्वेश्चन है कि जब एक मदर प्रेग्नेंट होती है तो उसका इम्यून सिस्टम नहीं काम कर रहा होता है इन द प्रोटेक्शन ऑफ अ चाइल्ड, तो अगर वही उसके अगेंस्ट काम कर रहा है तो सर जब इम्यून सिस्टम जो है एक चाइल्ड यानी कि मदर और उसके चाइल्ड का इम्यून सिस्टम सिमिलर होगा।
यार ये कहानी लंबी हो जाएगी, मैं बताऊं, है स्टोरी बड़ी मजेदार। मैं आपको शुरू में एक बात बताई है और वो आई ओपनर होना चाहिए आपके लिए कि मॉम, नेचर ने बेबी को रखा है, नेचर हैज प्लेस्ड द बेबी अवे फ्रॉम द मॉम्स इम्यून सिस्टम, हिडन। तो आप ये नहीं कह सकते कि मॉम्स का इम्यून सिस्टम बेबी को प्रोटेक्ट, बेबी है ही ऐसी जगह पे जहां पर पहुंचने के लिए पूरे मॉम के इम्यून सिस्टम से होकर गुजरना पड़ेगा। If a bacteria wants to infect the fetus, that bacteria will have to fight all the immune system of the mom, and then it ended into the fetus. Not every infection is eventually ended into the fetus. Nature ने बड़ा तो वो protected है since it is away from the immune system. तो जो immune cells हैं, moms के जो immune cells हैं, they will not going to enter into the fetus. हाँ, moms के antibodies they can, because antibodies are the protectors.
Okay sir, यानी कि
जी शाबाश, प्रोटेक्शन
इम्यून सेल्स नहीं जाते हैं, एंटीबॉडीज जाती हैं सिर्फ,
एंटीबॉडीज आती हैं, बिल्कुल सही है, बिल्कुल सही है, क्योंकि ब्लड नहीं जा सकता। ब्लड जो है वो प्लेसेंटा से आगे, यानी कि दैट इज प्लेसेंटा इज अ प्लेस जहां पर चीजें एक्सचेंज हो जाती हैं। मैं आपको एक छोटी सी स्टोरी सुनाता हूं यहां पर रोक के, बाकी मैं बाद में सुनाता हूं, पहले मैं फिनिश कर दूं इसको। नाउ द नेक्स्ट थिंग इज दैट, सो इफ टू क्योर दैट सिचुएशन, व्हाट वी नीड टू हैव, द मॉम शुड बी गिवन, द RH नेगेटिव मॉम शुड बी गिवन antibodies, because that will going to lead to the death. To my RH negative mom will going to have the RH positive baby, and that will ended up in trouble. Until unless the baby is RH negative, mom को problem नहीं है उस सूरत में। अगर आप एंटी डी से ट्रीट करेंगे, इफ यू ट्रीट विद द एंटी डी, तो इस केस में वो कहते हैं मॉम्स को इंजेक्शंस लगते हैं, कुछ दवाइयां मिलती हैं। वो दवाइयां क्या होती हैं? दोज मेडिसिन्स आर द एंटीबॉडी अगेंस्ट द एंटीबॉडीज प्रेजेंट इन द मॉम्स बॉडी। मॉम की बॉडी में एंटी डी पड़ा हुआ है, यू नीड टू रिमूव एंटी डी। So there are drug molecules which can capture, which can bind with those antibodies against the RHD. So they actually clean or remove all the antibodies against the RHD. Now the mom is once again ready like a first pregnancy, and she might be able to bear another RH positive fetus once again. So that is something. I hope this cleared this slide. And if you don't have any question, I will tell you a story. जी, I have a question. नाम क्या आपका? मैरीन मेरे से सवाल पूछना चाहती हैं। जी मैरीन, ब्लड ग्रुप्स के लिए होता है। हाँ, ये ब्लड ग्रुप्स के लिए जो मैंने एक्सप्लेन किया है, ये सिर्फ ब्लड ग्रुप्स के लिए। मिसकैरेजेस की रीजंस बहुत सारी हो सकती हैं, क्योंकि डेवलपमेंट एक बहुत कॉम्प्लिकेटेड प्रोसेस है, बट दिस वन इज वेरी ऑब्वियस, दिस वन इज वेरी ओपन, वी अंडरस्टूड एंड वी फिक्स इट। एंड सिंस इट इज रिलेटेड टू लाइक टाइप ऑफ हाइपरसेंसिटिविटी, देखो ना, मॉम की बॉडी को रिएक्ट नहीं करना चाहिए फीटस के अगेंस्ट। जैसे हमारा जनरल अंडरस्टैंडिंग है मॉम की बॉडी को फीटस के खिलाफ रिएक्ट नहीं करना चाहिए, बट मॉम की बॉडी कर रही है बिकॉज इट इज कैरिंग एन एंटिटी, इट्स अ हाइपरसेंसिटिव रिएक्शन। सो इफ यू हैव लाइक some sort of treatment, you can delete the antibodies in the mom's body will be clear and ready to bear one more.